It's going to have to get shifted. Time. Good afternoon, everybody. Thanks for coming here on short notice. I'm Chip Partner, AVP for Communications at University of Rochester Medical Center. We're here to talk about the bus crash. Sheriff Todd Baxter will speak first. Chief Deputy Michael Fowler, they will talk about the investigation. Dr. Mike Kamali, our Chair of Emergency Medicine, will talk about the patient status at Strong, and County Executive Bella will speak last. We did invite Rochester Regional to send a clinician, but it was at the last minute and they couldn't find anybody to come. Thanks. Sheriff.
Thank you, sir. Reiterate some of the things that occurred this morning. So about 7 o'clock, a little after 7 o'clock, we received a call for a motor vehicle accident on 490 in the westbound direction, just past Union Street. The initial responding Deputy Otley, found the tour bus flipped over on its side, facing 180 degrees in reverse direction, and multiple people wandering around that are obviously injured and confused, and they had escaped the bus. Deputy Otley tried to make entry through the front windshield, could not get through the front windshield due to injured people being in his way, and then went through partially through the hatch, the escape hatch, to assist people getting out. By that time, multiple people had responded, including civilians that were in the area and other responding deputies. They declared a mass casualty incident, requested 10 ambulances. And as you folks know already, it almost doubled from there by the time we got all the evacuees out of there. I'll let the chief deputy speak more on behalf of the investigation and where that's led so far, and the medical team here to talk about the incredible response by medical to save lives and do their job. But the first responders have just got to be recognized today for responding to their protocols, responding to their training, whether it's responding deputies or state troopers, the EMTs and their coordination of efforts with this Strong Memorial and Rochester Regional Health, and making sure they're prepared to receive these casualties. The fire department's working hand in glove with us and accounting for all the victims and doing grid searches of the area, making sure no one wandered off and wasn't accounted for. Department of Transportation now being on scene, assisting us in our investigation. Just a well choreographed, coordinated play from the standpoint that we have trained for this and prepared for this. And I have to give attaboys, attagirls, and kudos and many, many thanks to all the people that responded. I even seen friends from the Rochester Fire Department out there in Chi-Li on 490 today. So that's what it takes to solve one of these and get people to where they need to be. And now to reunify the families and make sure the investigation is done as thoroughly as possible. So I just wanted to reiterate my thanks as the sheriff to all those first responders from multiple different agencies, as far away as Genesee County came to assist us and coordinated efforts. There was no breakdown in communication. It was a seamless effort, and we can't always say that's going to happen in the future, but it was nice to see the coordination come together and people work together as a team to save lives. And I believe that's what they did today. So I'm going to turn this over to the chief deputy. I just want to say thanks to all them first responders, to these wonderful medical facilities that we have here in Rochester, whether it's Rochester Regional, University of Rochester, Unity, Highland. It's incredible. These guys are incredible. And for them to be able to receive these mass casualties at a moment's notice is the other end of the story. I think that's why we're here today, to share that part of it too. So thank you. Chief.
Thank you, Sheriff. I'm going to give you a brief update on the status of the investigation. We've transitioned time periods here. We've now concluded our preliminary investigation on scene. The bus has been uprighted by the tow company and is on its way to our secure impound lot where the remainder of the investigation will take place. So the preliminary investigation involves the interview of the drivers, the interview of the witnesses, the occupants of the bus, and the initial damage that we can observe at the scene. That preliminary investigation is leading us to issue the driver 4 vehicle and traffic tickets. Those tickets are for fatigued driving, for speed unreasonable, unsafe lane changes, and he was not wearing his seatbelt. The driver was actually ejected through the front windshield, but the injuries were not significant. So we do want to clarify that the driver continues to be cooperative, very cooperative. He was providing first aid to other occupants on the bus at the time of our arrival. There is a complete cooperative attitude from the bus company and the driver, so that's helping the investigation move along. And as I stated, we're now into the second phase of the investigation. This involves the mechanical inspection of the bus and the roadworthiness of that, as well as all of the driver's logs, his rest, all of those issues that come into play. That investigation is being conducted jointly with the New York State Department of Transportation, the New York State Police, and our Sheriff's Office Commercial Vehicle Inspection Unit. It's being done back at a garage, enclosed garage facility where they can take advantage of all of their equipment, all their resources, and preserve any evidence that may be in place. We're also going through the process of downloading and reviewing all of the video footage, both video on the bus itself and video from other passengers. I'm sorry, not passengers, but other drivers that were in the area. There were a couple dash cameras that we're attempting to see if they have any good footage that would be of use to us. This investigation, the mechanical portion, will take several hours. They're under no rush right now. They're going to take their time. They're going to verify their work. That's the purpose of using 3 agencies, is we get multiple investigative techniques completed, and then they verify their work against each other. So they get multiple reviews of the quality of that work. They're also working in conjunction with the district attorney's office. They sent a representative out to the scene to be able to get a firsthand look at the scene, to talk to our investigators. They've walked the length of that scene and reviewed evidence so far, and we'll be continuing that partnership back at the office and back in the garage where we do that vehicle inspection. Any of those charges that may potentially come from this portion of the investigation, we'll work with the district attorney for those. I am going to reiterate that we have established the Family Liaison Office. It is staffed and with an active phone number of 585-753-4455. That phone number is specifically for family members, loved ones that are trying to get in contact with their relatives that may have been on that bus. We are working diligently to try to get everyone back together and get them with their family members and alleviate some of their concerns. So that is in process, and the county executive has some more information about that. Several people are taking advantage of that right now. So things are moving forward with this portion of the investigation. As far as updates on the investigation, that will not be coming out for possibly another day or two. It will take quite a while for them to go through that process. I'm going to turn it over right now to Dr. Kamali from the U of R to give updates regarding patient status.
Thank you. Thank you, everyone, for being here. I'm saddened to have to be here, but honored to represent our very large department and institution. I'd like to piggyback what Sheriff Baxter said in terms of really acknowledging our first responders, fire, EMS, law enforcement, especially the Sheriff's Office, have done an incredible amount of work. I'd also like to thank our team at the hospital that is broad, from our registration staff, our environmental services staff, our social workers, our techs, everyone in between, and especially our emergency nurses who just rallied. As noted, at approximately 07:30 this morning, we received word that there was a mass casualty incident involving a bus crash with a number of patients. At that point, we rallied a lot of resources throughout the institution, and we also had, through our EMS liaisons, assets on scene. We initially received 13 patients, and subsequently we have received 3 patients in transfer from other institutions to us. With our assets on scene, patients were distributed across our area to the hospitals to balance out the load and saving as much space at Strong for the critical patients as we are at the level 1 trauma center. One of the patients is very critical and has been in the operating room. There are a couple other patients with significant injuries, other patients with moderate injuries, and then a number of patients that will be discharged from the hospital. This bus was carrying people, my understanding, from the New York City area to Buffalo, and had people from across the world. So appreciate all the efforts that people are doing to connect them with their families. And incredible effort across the board. I'm going to hand it over to Adam Bello, our county executive, to provide some more info. Thank you.
All right, thank you. First and foremost, I want to say how blessed we are as a community to have nothing but the finest first-class hospital systems that are prepared to handle a mass casualty event like this when it occurs here at University of Rochester Medical Center, Rochester Regional Health, and all of our healthcare providers. And I want to thank them and their staff and their teams that have gone above and beyond today to manage the sheer volume of patients that came through here today. We are also blessed to have the finest men and women at our Sheriff's Department and our first responders who, in a moment's notice, stepped up, undoubtedly saved lives, and responded to this incident. And I want to thank our Sheriff's Department. I want to thank our first responder community, EMS and fire departments, and also our residents who all stepped up to help support those who were involved in the crash this morning and were on the scene. Now, when a mass casualty event like this happens in our community, there's a role that Monroe County plays through our Office of Emergency Management. I want to thank Tim Henry, who heads our office there, Chief Tantillo, the head of our Public Safety Department. But the Emergency Operations Center kicks into gear to make sure that when you have different police, EMS, and fire agencies involved, our role is a coordinating role. So our fire and EMS bureaus and our coordinators were on scene to help assist the Monroe County Sheriff's Office and other responding agencies with the coordination of their efforts. We also, through our Office of Emergency Management, are assisting individuals and their families who were involved in the crash this morning as well. Obviously, this being a tour bus, those on that bus were not from Rochester. And so obviously they're anxious to get in touch with their families. Their families are anxious to get in touch with them. And they also need to get home, and they need a place to stay during that process. So I want to thank Visit Rochester. Visit Rochester stepped up, identified and secured a hotel that we've been working with individuals from this morning to house until they can be essentially so they can get a plan to get home. Also, those who are waiting for loved ones to be released from the hospital as well, they have a place to stay. And those who are being released from the hospital, as they're released, will be able to go to this hotel as well while we look to figure out how to reunify them with their families. There are 14 individuals that are currently placed at that hotel, and our Office of Emergency Management is assisting those individuals in their efforts to contact their families and help bring them together through the hotline that the Chief Deputy mentioned. Also on scene at the hospital is our Monroe County Department of Public Health is coordinating with the New York State Department of Health as well to provide services to the individuals who are at the hotel and those who may be at the hotel in the coming hours to make sure that they have everything they need as well. Thank you.
Some of the care that passengers got, what you do?
So when we received word that we were receiving a number of patients, first thing we did is rally support. Timing kind of worked out with shift change and other people available in the hospital. So we gathered teams to have a team for each patient that was coming in. And each patient that comes in through a protocolized manner, we go head to toe, evaluating the patients for injuries, obtaining x-rays, CAT scans, and the like. So a variety of injuries, head injuries, extremity injuries, some injuries to the torso as well. As you can imagine, in a crash, what we call blunt trauma, the injuries can be extensive. So anytime you have a mass casualty incident, and we train for this quite routinely, again, we gathered the resources. We'll hit pause on things until we get a sense of what's going on and how many resources we need. For example, operating rooms, things of that sort. We were fortunate that many of the patients did not need the operating room, so other patients who were waiting their surgeries, those could proceed. We had adequate space in the department at the time, so we were able to accommodate all the patients that we received from the bus crash, as well as other patients that were coming in at the time. That continued to operate normally as well. Right. So we have received 16 patients. Right now, I don't have an exact number. A number of those patients will be discharged. Some of those patients will be admitted to the hospital. Room is always a challenge. That's why we do have construction going here to build some additional space. But we will find room and we will take care of all of the patients.
Based on your conversations with the passengers, where were they going and why? Yeah, I don't think we got that far into this as far as that, Chief.
Yeah, a tour
Sorry,
to
Bert.
New York City is the most detail we have at this moment. Obviously, you can imagine the last thing they want to talk about is what they were on their trip for, right? We're worried about their medical care. We're worried about them getting reunited with the family, but we are going through that process. We do have the logs from the tour bus. We do have all of their stops along the way, both directions, and how many passengers were on and off. So we'll be working through that. We'll answer all of those specific questions in the near future. We do believe that, Syracuse and Rochester. We believe he discharged passengers. Prior to that, there was no indication of any trouble. There were no passengers that were complaining of anything with the driver prior to this portion of the section on 490. So we believe there were passengers from Rochester. Yes, he discharged some passengers in Rochester and then was on his way to Buffalo when the accident took place. Yeah. Well, to some extent, yes, right? A medical definition of asleep, I can't give you, but yes, we ticketed him for what's called fatigued driving based upon all of the evidence we found at the scene, the statements from the witnesses, and the driver's statement himself. No, we've done the preliminary investigation regarding that. There's been no evidence of alcohol, no evidence of drug at this point. We do have an order requesting a blood draw that will be sent to the lab. It will take some time for any results from that to come in. No, not that we're aware of. Thankfully, there were no other vehicles involved. The sheriff kind of indicated this. This was a very significant accident. The bus left the roadway, re-entered the roadway, eventually flipped, ended up on its side where it slid probably approximately 200 yards before it came to a stop on its side. And as the sheriff mentioned, the original deputy on scene attempted to get in to care for patients and couldn't get through the windshield, had to go in through the escape hatch on the roof that was now facing the side. Very small hatch, and that's what they used. When he entered that bus, there were approximately 12 people still remaining on the bus in all various forms of trapped or unable to get themselves out, that type of condition. So with the assistance of those first firefighters and some of the civilians that stopped, they created a team and they just started addressing injuries. There was a concern for fire at the bus. They immediately, wanted to get as many people away from that bus as possible, as quickly as they could. So they did an amazing job, had to push out some windows and use all means of egress that they had available to themselves. When we ticketed him for unreasonable speed, what that means to us is based upon our preliminary investigation, it appears to us that it was in excess of 70 miles an hour. They were not, no. We are in contact with the bus company and their representatives are just arriving on scene, but we've been on telephone contact throughout the morning with them. Again, very cooperative, providing all the information we've asked for. We're getting into this stage now where, we're coming up with new questions, right? As we uncover pieces of evidence and the investigation unfolds, it's going to lead to new questions and new discussions that we have with them. So they'll be remaining in the Rochester area for I assume several days, and we will be meeting with them each day for several hours and trying to, again, put together the remaining pieces of this investigation. Our initial review looks to be at least 20 years of experience driving.